Breathe Better Chester Initiative. On our team today, we have Sharon Benjamin, Mackenzie Blackstone, Aaron Hudson, and me, Curtis Owusu-Mensah, and we're from the St. Joseph's University College of Pharmacy. To start, asthma disproportionately affects minority and low-income communities, creating significant racial and social economic disparities. Black Americans are nearly 1.5 times more likely to have asthma, with Puerto Rican Americans nearly twice as likely. Without proper treatment, asthma can progress to chronic inflammation, more exacerbations, and even death. It is our responsibility to help reduce these disparities and improve patient outcomes. Chester City, a predominantly African American city near our school, lost its closest hospital on May 2nd. The closure displaced thousands from essential care, forcing residents to travel up to 40 minutes for services. As a result, key health needs, especially asthma care, are increasingly unmet. The Chester City Health Commissioner recently reported a 4% rise in asthma rates, with pediatric cases far exceeding state and national averages. Childhood asthma hospitalizations are 3 times the state rate and twice that of the rest of Delaware County, with the burden falling disproportionately on Black children from low-income communities. On the statistical graph, we see that Chester is given an F in particle pollution, meaning that the area has too many days of unhealthy levels of particulate matter, whether it be smoke, dust, or industrial emissions, all known asthma triggers. This problem is worsened by ReWorld, a waste-burning facility that releases over 200,000 pounds of particulate matter into Chester, further increasing asthma disparities. This, combined with the hospital closure, leaves residents with high exposure to asthma triggers and few local resources to manage them. Our goal is to increase asthma awareness and health literacy among Chester residents and youth, support environmental justice efforts through community discussions, and complete at least 100 asthma screenings with pre- and post-education data. We'll host community fairs to teach proper inhaler use and asthma mitigation, and attend additional events to screen residents using peak flow meters and guideline-based asthma control tests.
So we plan to reach out to potential sites, schools, churches, or community fairs, then create educational pamphlets and flyers, purchase our materials, conduct 2-hour training sessions with volunteers, partner with Chester community hubs, plan and confirm event logistics, be a part of the event, help community members and collect data, and then follow up with community members that might have been referred and analyze collected data.
For this project, we'll provide micro-life digital peak flow meters from Walmart to community members with uncontrolled asthma or COPD so they can monitor their breathing. We will allow patients with controlled asthma and COPD to try out the meter but replace the mouthpiece after each use to keep this project cost-effective. At our fair table, we will make both flyers and pamphlets, both in Spanish and English, which will include how to use the peak flow guidelines and environmental health tips. To boost engagement, we'll give small incentives to anyone who demonstrates their inhaler technique and learns the correct method. We'll maintain safety with proper hand hygiene and PPE. To connect with the community, especially kids, we'll bring branded swag, educational materials, and fun activities like bouncy houses and giant board games. Asthma affects communities far beyond Chester, and our goal is to make a broader impact. We'll attend local farmers markets, health fairs, and community events to teach proper inhaler technique with demo devices and assess asthma control. A key part of our project is partnership. We'll work closely with Chester-based organizations like Health Educated, which is led by the Health Commissioner of Chester, Chester Residents Concerned for Quality Living, and the Choices Youth Group. These partnerships will connect us with Chester community leaders, help us tailor our education to real community needs, and strengthen our reach at every event. We also plan to collaborate with PCP student organizations, including APHA and ASCP, to recruit students to help us at these community events. They will receive 2 hours worth of trainings to support screenings, demonstrations, and education efforts at each event. To support younger audiences growing up in challenging environmental conditions, we'll visit Chester schools from elementary through high school levels to teach them about asthma and help them become advocates for healthier living within their own families and neighborhoods.
So our initiative will be focusing on educating the community about lung health, so increased understanding of asthma triggers and how to use asthma medications, collaboration with local organizations, and increased awareness to help push for policy changes, and promoting long-term community resilience, and empowering students with knowledge on asthma, clean air, and environmental health. Some hashtags and acronyms that will be used for social media would be BBCI, Breathe Better Chester Initiative, asthma, which is used for education on harmful allergens and triggers for asthma, and then some of our hashtags include Breathe Better Chester and Healthy Air, Healthy Lives. And here are our references. That will be all. Thank you.